Good afternoon, Alex. Or
Good
good
afternoon.
morning, I should say. How are you today?
Very good, thank you. How are you?
Excellent. I'm really well, thank you. So thank you for joining us today as part of our Disability History Month campaign. And what I want to do first really is to get an insight into your background and what inspired you to go into the veterinary profession.
Sure, sure. So I am a small animal vet at the moment. I graduated in 2021. Um, my background really, I was not one of the vets who knew when they first started walking that they wanted to be a vet. I was very much up in the air until I was around about 16. I knew I wanted to do something scientific, but I didn't know what. And then at a careers event, it just kind of clicked. I was at a talk with a vet, and I was like, "This is what I want to do." I unfortunately just missed out from school, so for my A levels. Ended up going around the houses a little bit, and I took a year off, and I did a year of a degree that I didn't click with, and then did biochemistry. Coming towards the end of that biochemistry degree, I was again up in the air about what to do, and my now wife said, why not go for veterinary? I discounted it. I thought, this is it. I'm not going to be able to get in. I can't go as a mature student as a second degree. Looking into it, it was possible, and then sort of jumped in headfirst, and thankfully got through it. I think that's about my background in terms of how I got into the profession.
Cool, thank you. And what were the key moments, do you think, that sort of set you on your path?
It's a very good question. I think I've answered that slightly in terms of what I said. I think that careers talk with a vet was a big one for me, and just opening my eyes to what the profession is. I would say as well, the failing to get in and not getting in, that was a big kind of stumbling block, which, as I said, kind of initially said, okay, that's it, I can't get in, and I wiped it from my mind. But it stood me in good stead in terms of going into the veterinary degree as a mature student, and as a second degree. I think it was a different approach to university that compared to my first degree. I was much more, I knew what I was expecting. I knew what to do. I was less, let's go out and party, and more go home and watch Strictly Come Dancing kind of thing. It was much more focused on the work and kind of getting the most from it. And then ultimately, yeah, kind of the progression of my kind of chronic illnesses, and leading me down to a path of sort of going for advocacy and trying to change things rather than sort of fit into the sort of change myself to fit into the profession.
Great, thank you very much. And I guess that kind of brings us on quite nicely to the next question, which is really just, about, you talked about your chronic illnesses. And so just wondered if you were happy to share some details about that, and also how that might have impacted, your journey through vet school.
Sure, absolutely. So I have chronic pain in my right knee, a degenerative disc in my lower back, and then kind of a third nerve pain from that. And I also have depression. I've had depression for a long time. The chronic pain in my right knee was first. That's been 17 years. My back has been 10 years, and the depression's been around 14 years.
Okay.
It impacted me quite significantly into vet schools. I'm sure you can imagine. I think I started off vet school scared I was going to be found out, and that I would be, once it was realised that I had a disability, that I'd be kicked to the curb. I faked it. I pretended. I said, no, this stick, and the reason why I'm limping and I have to sit down is because I have a sports injury. It's new. Yes, I will go and tip these sheep, and then I'll go and kind of cry in the corner and hide, because I just did not want anyone to suspect that the physical limitations I was showing, I guess, were long term, and it was going to be like that throughout the course. I kept doing that. I kept hiding. I kept pushing myself too far and ending up unable to move on a lot of very strong prescription pain relief from the doctor, which helped with the pain, but I couldn't study. I couldn't get out of bed. I was very the brain fog was just too much on them. So I had this kind of cycle of being off pain relief, pushing my body too far and being in too much pain trying to do things, and then going back onto pain relief and being bedbound and not being able to study. So I was getting the worst of both worlds, really. It came to a head at the end of my second year. I had not been able to be in uni, and I'd failed quite a few of my exams, and I was facing the prospect of resitting the year. And I thought something's just has to change. Something needs to change, because I'm not going to get through this degree, this course, and I'm not going to get into the profession that I really want to be a part of if I keep on pretending. So I was lucky that I had some allies in the faculty, people I could speak to. I had a good mentor, and that changed my perspective on things. From I'm going to hide and hide away, and I'm going to fit into the vet school, to I'm going to be open. I'm going to say I have these disabilities, and we need to adapt. We need to put in adaptations into place, and we need to change. And some of those adaptations were welcome with open arms. Others required a little bit more pushing. And I think the more open I was, the more other students came to me and said, actually, I'm going through something similar, or actually, like, don't tell anyone, but this is happening. And it became apparent that there were much more of us than was suspected, and that what you think. And you can feel very isolated, and you're all trying to hide, but there's everyone there is going through something at a varying degree of difficulties. And it's things that I started to put in place were, I'm going to show my knowledge, I'm going to show my competency, but I'm going to show it in a way that doesn't then mean I can't do anything afterwards. So yeah, I'm going to explain how to put a poultice on a hoof, but I can't bend over for 15 minutes putting a poultice on a hoof, because then I won't be able to walk. So how do we adapt to that? How do we change things? I had OSCE practical exams where it was like, okay, well, let's just move this model onto the table instead of me bending down onto the floor and trying to fix it down there, because I've got 3 more stations after this, and I won't be able to do them. So it for me, it set me on a different path. I started getting more active in the wider community. I started sort of joining with and working with BVCIS, and becoming more of an advocate for change, rather than just saying, I'm going to try and get through this. I'm just going to just keep my head down and force my way through the degree. Because ultimately that would have either led to me likely not getting through vet school, and dropping out, or scraping through, getting into the profession and continuing that mindset in work. And the same thing would have happened. It was a ticking clock. There was going to be a point where I would not be able to do anymore. I would not be able to keep going. So it was tough. It was very tough.
Great, thank you for that. I want to take you back to something you said right at the beginning, when you talked about the number of years that you had these, different conditions, and you mentioned that you had experienced depression for 14 years. And I wondered whether the 14 years was from diagnosis or from what you believe was onset of depression.
Yeah, and it's a really, really good question. I think it was from diagnosis.
Okay.
Onset of depression is slightly scarier number, which is 18 years. So I was struggling with mental health from around the age of 13, and it was all centered around a significant loss, a significant kind of loss of a relative, and that never being properly dealt with. And again, I think there's it's a stereotype, but it's true, and men in general struggle with being emotional and sort of letting those feelings and addressing those feelings. And particularly my upbringing, it was difficult for me to express that. Became internalized a lot, and again, it only really came to the point when things got really bad with my mental health that diagnosis was made. And then, unfortunately, my support structure at the time was such that when I took that step and I went to the doctor and I had that diagnosis, it was turned to, well, I've ruined my life now. I've got this this label of being depressed. It is on my records till the end of time. And again, that set me back. I think I went through, with both chronic illness and with depression, I've been through periods of almost self-denial and trying to say, no, I'm okay, I'm fine. I don't need this, I don't need the support, until it gets too bad. And then I realized, yes, I do. And it's an ongoing battle with everything. I think I'm still learning. I'm still learning how to deal with things and how to approach and address problems. And it's just that each time you face those issues, you have a new skill set to try and deal with it, and you learn something else, and you learn for new help and new ways of reaching out. So it's an ongoing struggle.
Sure. Great, thank you. And what approaches have you adopted to manage your pain so far?
Very good question. So as I kind of alluded to earlier, pain relief, the only pain relief that works makes me unaware. So I can be free from pain if I'm free from this basically. If I'm just zonked out on the sofa, then I can be free from pain. But obviously, how do I then do that and work? It's impossible. How do I do that and continue to be present for my wife and for my baby? It's impossible. So it's very much about what could I do to limit things or manage it. It was important for me to have a rota that works for me, I think, and that I found useful. So one of the things I found useful during my final year rotations was, I'm going to preemptively take a day off in the middle of the week. I'm going to say I can't do 5 days in a row, because I know when I get to 3-4 days, I'm going to be really struggling. I'm going to be in a lot of pain. So I took that forward into my job, and I work long days, but I work 4 days a week. I have a Wednesday off. It gives me time to recover physically. It gives me that boost of, if I'm struggling on a Monday night, I know I have one more day, and then I've got some time to recuperate, to recover. I can go to a physio, I can go to a doctor's appointment, and I can use that time to reset myself a bit. Don't get me wrong, there's still days when that isn't enough, when that Wednesday's still not enough and I'm still struggling. But my practice were incredibly accepting of things. I was very open when I applied for jobs, and I think it was the first line on my CV. I think at the very top was, my name is Alex and I have chronic health conditions. And I used it as a screening process. I used it, if I find a practice that, or if I speak to a practice that does not want to try and put options in place, then I know they're not going to be right for me. So I'm going to screen you just as much as you're going to screen me on applications. So my practice, as I say, I sit down for the vast majority of my consults. I walk around with a stick most of the time. I have kneeling pads. The staff are aware of me, and the more that I've worked as well, the more they can see those subtle signs in me that I'm trying to hide, that I'm in a bit more pain than I'm letting on. They will almost be the logical side of me that says, I'm going to stop you from being the bum stop and jumping in and helping to restrain this animal, or I'm going to stop you from carrying this anaesthetized 50-kilo dog through. And they're going to be like, okay, no, just sit down for a minute. The three of us will do it, and we'll get you sort of over when you're needed. So I'm very lucky in that respect. I think, but as I said, it's a constant struggle. It is a constant struggle, and I can, even just recently, I had a mental health struggle, and I needed time off. I needed time to recenter myself, I think, and get back into it. And again, everyone's been very accommodating of that. I think it's important to have that kind of non-judgment that from your colleagues, and certainly it's on my about me bit on the website for the practice is, I have a stick. You may see me using a stick some days, you may see me not using a stick other days. I've got a little tennis ball at the end of my stick, which helps trick dogs into the consult room. There's things that I'm being open about. I'm saying, okay, I'm not going to do this, but that doesn't make me less of a vet. So they're the kind of the everyday things I've been implementing.
Yeah, and I guess what I'm hearing are a number of kind of themes coming out. So one is very much around activity pacing. The other one is around, you having the self-awareness to know when you are struggling, but then also being open enough to make people aware that you are going through some moments of difficulty, or equally just when you need some adjustments or some adaptations that need to be made within the environment. I guess also out of kind of interest, how has that played out in terms of the interactions you have with clients that you see? Are they generally quite sort of receptive? Have you had any sort of challenges there in terms of how clients might react to you when they see you're sort of walking with a stick or any of those sorts of things?
Yeah, it's a really good question. I think the vast majority of interactions with clients is positive. There is sometimes kind of an inquisitive nature, a sort of curiosity, and questions like, okay, so how have you hurt yourself, or thinking it's something acute, and again, it's me saying, well, it's chronic pain, unfortunately, and it's that thing of, when you come into the practice, you may see me walking around without my stick, but you may see me really struggling and walking around with my stick, because every day is different, and there are things that make the day worse, and things that make the day better. So it's also, I like to think I have a positive way with clients. I'm quite friendly, and with some of the clients who are using sticks themselves, bringing them in from the consult room, it becomes almost a little bit of a game sometimes. And it's like, okay, well, you're beating me, you're faster than me today, you've got your stick and you're racing ahead of me. And it's that kind of, there is a way of turning it to being more kind of empathetic, more building rapport with the client, more than it being a barrier, I think. So I don't think I've had a negative interaction where, apart from that curiosity, and I welcome that curiosity, I think. But I can appreciate how some other people would not, and would prefer to be a bit more, well, I'm using a stick, why are you asking me why, I think. So it's very individual. I think just personally the way I deal with it is being more open and saying, okay, you're asking me, you're not saying I can't do my job because I've got a stick. You're asking me out of curiosity, out of wanting to strike up a conversation. And I think that's something that I welcome, and kind of take it at face value, rather than the potential prejudice that it might be, I think.
And it's interesting because, you know, a stick ultimately is something made out of wood, but actually it has a much kind of larger signification than that, because essentially the stick is almost a kind of a transition from something that is invisible to something that is visible, because a stick is basically the trigger that makes people ask questions, right? About,
Absolutely.
is something wrong? You know,
yeah,
if you didn't have the stick, nobody would know, and nobody would ask you.
I completely agree, and it's kind of been the double-edged sword with my physical conditions, and the fact that on the one hand, I've had to use the stick. On the other hand, it has made the decision for me in a way. It has meant that I need to be open. My disability in that sense isn't hidden. It is not something that I can pretend isn't there effectively. So it's made the way I approach it to be open, and here I am, look at me, kind of thing. Whereas for other people who are dealing with physical disabilities that are hidden, the decision's much more difficult, and the decision becomes a lot more, how do I approach this if it's going to impact on something, or if I'm going to have to adapt to a certain way, and I haven't got that big waving red flag of a stick. How do I approach that in a way that is natural and is going to lead to that, again, that positive response? So I think it's difficult, but it's something that has kind of helped me almost, that I need to use a stick the majority of the time.
Sure. Great. Thank you. So looking back to when you first started vet school and where you are now on your journey, how do you feel conversations about chronic illness, about mental health in the workplace or in the veterinary profession has evolved?
I think there has been some real positive steps, but there's still a lot more to do. I think with mental health, we have had a really strong drive in the profession in terms of acknowledgement that mental health is something that we will all struggle with from time to time. And I think the important thing there is will. It's not we may. It's that every one of us within the profession will have a time, be it short or be it prolonged, where we will face a mental health challenge. And that doesn't mean severe depression. That doesn't mean needing medication. That can just be feelings of burnout, feelings of difficulty in the day. And I think we have become much more aware of that. And it's something that is taught pretty much from day one at vet school as well. And I think it's preparing people for, okay, let's see how we can acknowledge those signs of struggle and help each other out. I think the Vet Life charity is absolutely amazing. I think it's a real strength that we have it in the profession, but it's also a bit of a sad thing that we need to have it. And it's how do we try and get to the point ultimately where we don't need to have that resource, where we as a profession are working without risking mental health of its members. I think the chronic illness and disability awareness is far less. And part of that is due to the extreme variety and the variation in people's conditions. There is no one size fits all approach. But I think as well, it's difficult in terms of we will all likely face some form of physical ailment, some form of chronic health condition at some point. And the profession is very physical. No matter what aspect of it, it is physical. So my hope is that the drive and the push that we've had with mental health awareness continues into that kind of disability and chronic illness as a wider bracket, because there is more awareness, there is more understanding and push for change, but we still are preventing or putting up roadblocks to students with chronic illness and disability to even getting into vet school. People can't get their foot in the door to even start to proceed into the profession because they have a chronic illness, because they have a disability or a something that may require more adaptations, sort of adaptations to things that we need to be doing better.
And of course, I mean, that will also link very much to, the culture within, the workplace. Is a culture such that actually people feel enabled to be able to disclose that they have a mental illness, or they have a chronic illness? Because I would imagine, if you look at the stats, I think it's 1 in 4 people in the UK live with chronic pain, but actually the reality is probably higher than that. It's just that not everybody has disclosed what they have, if that makes sense. So I do think culture's a very important part to that as well. And I guess you've kind of already sort of touched upon it slightly, but just want to kind of talk about it a bit more. And that is really about barriers that you think are preventing further progress from being made with regards to perceptions and attitudes towards chronic illness, mental health in the vet profession. What needs to be done to kind of I guess overcome those barriers as well?
Yeah, it's a very difficult subject. I think from a initial part, getting into vet school, there needs to be more of an individualized approach to vet students, and to understanding that, okay, this prospective student may be using a wheelchair, but we can find a way of them doing this degree. There's very few degrees that would say, well, you're not able to join because you have a disability. There's very, very few. And I think there's no reason why we can't be adapting the degree and the course as such that we can improve the sort of representation of disability and chronically ill students in the kind of cohort. I think the main barrier in terms of the profession as a whole is there's still this stereotypical, at least in my experience, there's still this stereotypical image of what a vet is, and it's very much this kind of almost like a superhuman vet who can do everything and do anything, and is healthy and is not facing any, doesn't have a twinge in the back, and can do absolutely anything all hours of the day. And the truth is, no one fits into that. No one fits into that bracket at all. But we are all subconsciously striving for it, I think, and it's damaging to us all. I think it's damaging to us not accepting that we have limitations. We are human. We have things that we'll start to struggle with, and we need to be able to raise that as a shout for help, and that be heard and implemented, if that makes sense. I think there is almost a bit of a chicken and egg situation as well, in terms of we're at a point where the understanding that there are more of us than you think, that there are more people who are struggling with chronic illness and disability, but are hiding it and are suffering by hiding it. The more people that speak out, the easier it will get, because the more representation we will have, the more acceptance that this is not abnormal in oppression, this is the norm. There are more of us, that we need to be, these adaptations that we can put in place and adjustments are needed and valid. I think the perception that putting an adjustment in place, be it in the workplace or be it at vet school, either gives an unfair advantage or is too much hassle, I think is dangerous. Quite often, a lot of the adjustments are beneficial for everyone. For example, sitting down in a consult room, like show me a vet who doesn't want the option of sitting down in a consult room in small animal. It doesn't make sense. I sit down in a consult room, every other vet does. It's not a big adjustment. It's not something that you think, oh gosh, this is a hassle. But there are practices that won't. There are practices that say no. It's those kind of adjustments that benefit everyone. It's not about trying to get a leg up on the rest of the team or the rest of your students. It's about trying to level the playing field and say, this is going to help me perform to the best of my ability. This is going to help me. It's going to remove that starting kind of barrier, I suppose. That kind of you're already starting a few 20 meters behind in the race. This is about kind of bringing you up to the level so that you can all sort of have that fair shot. I think those barriers are breaking down, but there is still, at least I feel in my experience, there's still an attitude of from vets, I had it bad, so why should you have it better? It's very much, well, okay, well, when I was studying, I had to do 16-hour days, for example, so you should be as well. Or when I was at your stage in the career, I was working on call every night for the week, so you should be as well. And it's backwards, right? Because we should be I mean, we are clinically, and with knowledge, we're a profession that hopefully continually improves and continually strives for that continued professional development. But when it comes to, okay, can we develop things for work-life balance, it seems backwards. It's like, why are we constantly improving our clinical knowledge, but we're not improving our actual work life? Really, there's no kind of learning from past mistakes. It's very much just continue repeating them, because why should you have it better? So it's, that culture is damaging, and I hope that that culture is starting to shift and change, because it's been a long time coming. I think it's
Yeah, I mean the word that comes to mind, or the words that come to mind, are earn your stripes.
yeah,
And back in the day, you know, you used to see it in lots of different professions where, you know, you had to prove that you deserve to be in this role or in this profession, and so therefore you had to kind of do the hard yards, so to speak,
yeah,
to make people believe that actually, you know what, you're okay, and you can do the job. Whereas actually what we're saying is that, you know, bigger picture, if you actually want to retain people, and you actually want to encourage more people and increase, you know, diversity within the workplace, then you need to move away from that mindset. Otherwise, you know, it's never going to change. I think really is kind of what we're saying.
absolutely. I think the idea of throw them in the deep end and sink or swim,
Mm,
and 50% will swim, excellent, you'll get vets at the end of it. 50% will sink, and you've lost 50% of your workforce. Stop looking at it as a glass half full. It's a glass half empty approach. You are
yeah.
getting rid of good, productive members of the team because you're saying you have to do this to prove you're good. It's like, no, they've been through hell in vet school. They've been through hell to get into vet school. That it's such a damaging approach to particularly those first formative years in the profession. I think it's really, really dangerous, and that's why you're seeing a big push from a lot of the corporate companies, and with the new grad schemes, and a lot of independents in terms of implementing new grad kind of support and mentorship. And with the RCVS and with the vet GDP kind of overhaul from PDP, and it being, there's an increased awareness of how damaging a bad experience in those first few years can be, and that as a staff retention issue, the solution isn't to increase the number of vet schools. The solution is to increase the number of students that get into the profession and stay in the profession.
Yeah.
Really, it's tricky. And ultimately as well, that diversity and building diversity and drawing upon other experiences and approaches to the same issue, the same problem, I think is only beneficial for the profession and for the practice. It's a tough one.
Thank you. Okay, so next question. What steps do you think vet practices should take to ensure that they are providing optimal support to people living with chronic illnesses and mental illness as well? And I know you've already kind of, you know, talked about a few sort of examples, but I guess if you were to kind of boil it down to just, you know, a handful of things that could be a takeaway for any
Yeah.
sort of vet practice to consider, what would it be?
Be open, non-judgmental, and listen. It is not about what you think is best for that person. It is not about you saying, you're struggling, I'm going to do this. It is about you being open and letting someone come and talk to you if they need to. And yes, if that is a gentle kind of prompt in terms of how are you doing, how are you feeling, but if that person hasn't disclosed something, they have no need to disclose it to you. But if you are closed off, if you are potentially going to be cynical of what they say, or they perceive that's what's going to happen, and they are concerned about a fear of reprisal or approach from opening up, it's never going to change. I think you should be open to implementing changes within those reasonable adjustments for anyone. And it's how, as line managers, as practice directors, and is how do you convey that to your staff? I think when someone is, or when someone has disclosed something to you, it's again, it's about using those check-in moments, those kind of monthly catch-ups of being not just how has your disability impacted your work this week and can we do anything to help, but more, okay, well, you know, how are you finding things, how are you feeling? It's being very open. It's more about what do you need from me, not from saying here's what I need you to do. Because the final thing I would say is acknowledge that what someone needs today isn't what they might need in 6 months' time. And just implementing an adjustment on day one doesn't mean that that adjustment is not going to need to be amended or built upon later, further down the line, or reduced. I think it's very, there are a lot of chronic illness conditions that vary and vary from day to day. So it's being aware of that. It's the same with me. If on a day I'm walking around and I don't have my stick with me, it doesn't mean that I'm all of a sudden better and I can do everything under the sun. It means that I'm feeling a bit better today, but I'm still in pain, but not in pain to the point that I need my stick. So it's that kind of awareness that there are peaks and troughs, and it's a roller coaster, not a flat ground.
Yeah, exactly. Yeah, indeed. Cool. Okay. My next question then, what advice would you give to students living with a chronic illness who are at an early stage of their journey through vet school?
It's a very good question. I think it's difficult. The most important thing is you're not alone. No matter how isolated you feel or how scared you are that you're the only one going through it, I guarantee you there are plenty others that are going through it. Try and find those allies in the faculty, be it your mentor or be it there will be someone whose passion is diversity inclusion. Whether that's their job role or whether it is their passion and what they're sort of striving for in the vet school, there will be people there, and it's about finding people you are comfortable approaching and discussing things with, because you find those people and they will go to bat for you. They will fight your ground and they will support you. Occupational health for me was really useful. But I have heard from other people where it's maybe not been as useful as they had hoped. But from personal experience, it was a useful tool for me. And I guess the other thing is sort of saying it's really tough to get into vet school. It's really tough. You're in vet school now. Find like the course can adapt to you within reason, but the course can adapt to you. We've proven it with COVID-19, where all of a sudden all the vet schools closed and everything was online. And then it comes to me and I'm struggling to get into vet school every day. And all of a sudden I can go downstairs and sit at my computer with an ice pack on my knee and a lovely lidocaine patch on my back in my reclining chair, and I can attend every lecture. And there's me thinking, well, why couldn't have this been like it for the past 5 years? And to then go back after that, in terms of the COVID-19 pandemic, you know, thankfully those restrictions have been lifted and it's easier to get back into vet school. And it's very much, well, yeah, no, you have to be here all the time. It's like, well, why can't I watch the lecture online like I did last year? So the cat's sort of been let out of the bag now. I think we've proven we can do it when our hands are tied and we're up against the post. Let's continue doing it when we should be doing it instead of just when we absolutely have to. So it is the last bit of advice I would say. I don't know, I'm whispering on. The last bit of advice is it will make you a better vet. As much as it may seem as a negative now, the resilience that you need to build, the strength in character, and the way that you problem solve and find ways of doing things that other people maybe don't need to, it will make you a better vet. And it's trying to turn that from it being a negative to of this is I'm struggling and this is going to be horrible, to this condition is going to be positive. This condition is going to make me find new ways around of doing things, and I've employed those things in my job. I think it's made me much more of a lateral thinker when approaching an issue, when approaching that kind of diagnosis of I don't know what it is. It leads you down, even just your brain having to think, okay, how do I go to this practical when I can't even walk into the building? Okay, how am I going to do it? How am I going to do X, Y, Z? Those kind of thinking, that's what you're going to be doing daily in your job, and it's that kind of transferable skill that's going to really impact things positively.
Great, thank you. So we've covered a lot in this discussion today, and I wondered whether there were any sort of kind of final sort of takeaway messages that you wanted to leave the audience with.
Okay. I'll try and boil it down and be very, very quick. To vet students, you're not alone and you can do it. To prospective vet students, keep going and keep trying. To vet schools, approach things individually, find a way to make things better for each individual student, and be open to improving representation of disabled students in the cohort. To managers, line managers, again, be open and listen and be willing to help. And then to everyone, having a positive impact on someone with either a mental health challenge or with a chronic illness or disability isn't just about fundamentally changing the profession. It is about those little things. It's about seeing someone struggling and saying, can I get you a cup of tea? It's about seeing someone like maybe looking like they're in a bit of pain and grabbing them a chair. They make a world of difference. I think we can all have an impact on everyone else. Those little things are so important.
Great.
Yeah.
Thank you so much, Alex. It's been a real pleasure.